Hi folks, my name's Tony and I'm based in the south of the United Kingdom. I had a problem recently with my right knee. I do a lot of sport, I still do a lot of circuit training and boot camps every week, and for months and months I'd had a problem with my right knee. Basically it had got a really bad kind of lump on it, which I later found out to be a bursa, and this is the old traditional housemaid's knee as it was known in this country, but basically it's an inflammation and it was very difficult to kneel on and so on. So I went to my local GP a few weeks back and was told unless you've got a private insurance policy, Tony, tough luck, the NHS ain't going to do it. So this was a bit of a dilemma for me. I was going over to Turkey anyway with my wife a couple of weeks ago, so I thought, you know what, maybe I can phone up a medical outlet in Antalya in Turkey and find out if there's anybody there that possibly could do some surgery. No doubt it would be a lot better than doing it here privately in the UK. So that's what I did. I did my research first. I went online, checked out a few hospitals, and the Memorial Hospital in Antalya came up with a really great track record and a big orthopaedic department there as well. So I sent them an email, and this was on a Sunday afternoon, and within minutes Clinics on Call had called me back, well, emailed me back, and then interactions one way or the other, and we booked an appointment for the first day. Second day I was actually in Antalya on the Friday, which was really, really great. And so off I went to the Memorial Hospital with my appointment booking from Clinics on Call in hand, and there I saw Dr. Murat Beluglu, who is an orthopaedic specialist. He does a lot of sports and athletes orthopedic work and stuff as well. I was ably assisted because there was a lady there called Ava who is employed by the hospital as a translator, so she was there for me to translate A, my problem to the doctor, and B, the diagnosis and the recommendations from the doctor, him having had a good look at me and come to some conclusions. And they presented me some options. Basically I could have it drained, which might well come back again, or I could go for an alternative surgery, which would be to actually remove the bursa sac, which is the sac on the kneecap. Bear in mind you couldn't kneel on it prior to this. So I thought, well, do you know what, I might as well get it all over and done with. I believed in the team, the hospital looked really nice, and Ava was really helpful, so I thought, yep, let's go for the full Monty. So there and then, that day, within 2 hours, they were operating on me and removed the bursa from my bad knee and sewed me back up again, which was really great. And thereafter I was under their care for a couple of visits after that in the week that I was there, just to make sure that I was recovering well, no infections, that kind of thing, but also to make sure that I got adequate antibiotics and anti-inflammatory. I was icing every day and so on, and so it was a really great experience. Good to meet with Ava, who was a fantastic